representatives of those brown faces seeking care and treatment, even as our government discusses the need for cultural competency around the nation and installs policy changing requiring hospitals, agencies to demonstrate cultural competence. There is no suggestion of cultural competence that tinkers with the root causes of the ever increasing pandemic AIDS. What if it matters who directs the resources in the fight for AIDS eradication? What if those who always sought to care for and cure the afflicted are unconsciously creating roadblocks to the eradication? Running programs and insufficient resources, the Center for Disease Control has long decided that the minority community-based organizations running programs servicing the community is a good idea, but getting those money to the organizations have always been decided by planning committees that do not reflect those that seek the money provided. Perhaps the dissemination of information surrounding AIDS and constant fights one must engage in to get the resources from pharmaceuticals, transportation, housing for consumers has left people so spiritually depleted, all they can do is handle what is given to them. Or perhaps there is something more basic at work. People just don't want to have to fight. Black people don't want to advocate as a part of their job. People don't want to have to ensure resources for many. If it is preferable to assist a consumer one at a time. Triage is not happening. Blacks account for 14% of the United States population and over 50% of the HIV cases. Shouldn't this glaring imbalance cause all treating the disease and allocating resources to triage the black community? Doesn't triage mean considering the situation at hand, dealing with it? Additionally, even as many of our regions have taken up the cause of having people fighting for the return to praying in schools, there has been no rallying call for people to increase the number of ways to distribute prophylactics or to increase reproductive health and education to those most affected by the HIV and AIDS pandemic. What can we do? What's done to use professionals in the HIV field to need to think about the changes that occur in the field? What structural elements are holding back the walk towards a cure for this pandemic? What does it mean when black people choose to go along to get along?